Okay, now we have our first panel discussion for today. We will have Ahmer Inam, who's the Chief Artificial Intelligence Officer and Chief Product Strategist at Pactera Edge. Ahmed is a seasoned data and AI practitioner and thought leader with over 20 years of experience in the domain. He co created the Mindful AI framework that integrates human centered design, rapid prototyping, and MLOPs to accelerate concepts to capabilities and drives successful AI solution integrations and adoption. In addition to Tarek Khorshed, a lead technology architect at the World Health Organization in Geneva, he holds a PhD in computer science engineering with a specialization in AI for disease detection and diagnosis. The discussion will be moderated by Shaikha Othman, who is an IU35 alumna, an entrepreneur, and a firm believer that entrepreneurship serves its purpose through cultural and policy change, which she actively pursues in her startup, House of Care, tackling the growing elderly population. It's going to be a great conversation, and I invite you all to head to the next stage, how mindful AI can contribute to advancing public health. Sheikha, great to see you, and the stage is yours.
Hello and welcome. Thank you for being with us. And thank you, MIT Technology Review Arabia, for this amazing conference. Our topic today is how mindful AI can contribute to advancing public health. And we're going to define what public health is and more so define what mindful AI is. I have with me two amazing brains. I look forward to this conversation. I hope you guys engage with this. I have Ahmer Inam. He's the Chief Artificial Intelligence Officer at Pactera Edge. And has more than 20 years experience helping organizations transform to human-centric intelligent solutions, and we're going to define what that means. And he's the co-creator of the concept of mindful AI, which is also the topic of the discussion today. And I have with me Dr. Tarek Khorshed. He's the lead technology architect at the World Health Organization, headquartered in Geneva. And Dr. Tarek also holds a PhD in computer science engineering with a specialization in AI for disease detection and diagnosis, and amazing brains with amazing perspectives, interesting things that we're going to explore. So I'm going to, before we start, I'm just going to leave a message with the audiences. If you have questions, please do submit them as we go through the conversation. And we're going to dedicate the final 5 minutes to answering your questions. We're going to try our best to attend to everybody. So without further ado, I'm going to start with the questions. And I'm going to start with you, Dr. Tarek. So Dr. Tarek, you have fantastic research with using AI for cancer tissue diagnostics. I want to know, and I'm sure I'm not the only one, I want to know, where do you think we stand today in terms of reliability of this technology? How soon are we going to be able to rely on this technology? And yeah, like how are we going to be reliable? How soon are we going to be? How soon is this technology going to be reliable for use in the healthcare space?
Well, hello everyone. It's really a pleasure to be with you, and thank you very much for this opportunity to have this discussion. So thank you, Shaikha, for the question. And of course, AI is really one of the very fascinating areas of computer science, and it hasn't become. It's not a new area anymore. It's something that it's affected every domain, and it's really concerned with how we can build more intelligent systems that can actually learn from data and actually help us make better decisions and make better predictions. And ultimately, one of the goals of the work of AI and the researchers is really to replicate the human mind or the brain, and really the capacity that we have to actually learn from different patterns and make decisions. So AI, machine learning, and all these technologies have really affected a lot of areas in our day-to-day life. So we see them in computer vision, we see them, of course, in the areas of autonomous vehicles, like we see self-driving cars, we see them in natural language processing, we see them in even cybersecurity and fraud detection, even online shopping and personalization. But one of the very important areas, besides all these topics or all these domains, is really how we can use AI and these technologies in healthcare and in public health. And there's been a lot of work within the research community, within academia, and within the industry, is really how to benefit from all this revolution or all these AI technologies for healthcare, and in particular for disease detection and diagnosis. And maybe, Shaikha, you were mentioning specifically around cancer. So cancer is just one of the many examples how these technologies can be used for disease detection and diagnosis. And of course, we all know cancer is really an incurable disease. It has a very dramatic impact all over the world. And one of the very big challenges around cancer is that when patients are diagnosed at very late stages, then it becomes very difficult or challenging for treatment. So this is really where AI, genomics, and maybe technologies like next generation sequencing can come in. So by really using DNA sequencing and RNA sequencing, we can start understanding better the molecular signatures of a cancer tumor. We can start understanding really the progression of the tumor, and we can start using technologies like deep learning to really build models which can understand the genomic signatures of maybe tumor samples and both healthy samples. And we can use techniques like supervised learning to be able maybe to detect and early detect signs of cancer and really to help save lives. So this is really one of the fascinating areas which is receiving a lot of interest and a lot of work. And there's already quite a lot of research being done in that area.
Right. What would you say are the limitations, Tarek, to relying on such technology for early detection, let's say of cancer? Let's use cancer as a use case. What would you say are the limitations? And I want to move on to Ahmer later on, of like the definition points, but I want to first cover this because it's relevant to your answer.
So that's a very important point. So it's very important as we talk about the potential capabilities of AI and how powerful it can help us for disease detection and diagnosis in cancer and other diseases. But we also have to understand the limitations and challenges. So availability of data is really one of the key prerequisites of building or designing an AI system. So in order to be able to learn the molecular signatures of a cancer tumor, to be able to predict it accurately, we need to have a lot of patient samples or data. And of course, this is always a challenge. So we need to collect patient data for both healthy samples and tumor samples from different tissues, from maybe different geographic locations under different circumstances. And this is to avoid problems with imbalanced data or bias when we sort of build or create a model that it doesn't, it actually learns a very, very limited or scope of the disease and is not really able to generalize in a more general context. So lack of data and reliable data is really one of the challenges. And although this is a very big challenge and limitation, but as we go into the discussions, there are a lot of different techniques and tools we can use to overcome these challenges.
That will be a very interesting thing to follow up with. But for now, I want to move to Ahmer. Ahmer, welcome to the panel. Thank you for
Thank
being
you.
with us. And you are, as I mentioned, you're the co-creator of the Mindful AI
Mhm.
concept and the framework. And I really want to know not only what it is, but why and how you came up with it.
Yeah, it's a great question, and it kind of ties to some of the things Tarek is talking about, as well as far as AI and cancer research is concerned. So the promise of AI is very pervasively accepted. We all understand. We're talking about in conference to conference. We've been talking about it for ages. But in a paradox exists between the promise of AI versus the adoption of AI. 90% of the AI solution, AI projects is still fail the adoption test. And research after research is showing why is that, right? And it comes down to us humans refusing to change is innately in human nature. When it comes down to the research that's showing us, it comes down to experiences, it comes down to trust, it comes down to reliability, it comes down to culture, cultural nuances at enterprise level and in the countries and the regional specific. So when we think about it, The reason why AI is failing the adoption test is human. That means we have to lead with empathy. And when we talk about the empathy for the people who use it and the people that's going to impact. And leading with empathy ensures that when we are leading with a sense of purpose and intention around why we're building an AI solution, it helps us design a solution that's leading with the problem that we're trying to solve for versus leading with a solution that's looking for a problem. So essentially it changes the dynamics around and the positioning around how do we build a solution and why we build it. We change the orientation from just not just automating tasks, but understanding what we do, why we do it, right? So the why, and then that's the crucial element of it. And the creation of this whole framework allows us to infuse an empathy-led human-centric design principles with rapid prototyping, understanding the right fit, to designing it with the people for whom we're designing the systems, and then bringing in the best-in-class AI engineering and algorithms with a lovable experience to ensure that we design a product or a solution or an ecosystem that actually gets used and then its impacts and it addresses the core of the pain points that we're designing it for.
Right. This is a very interesting. I think empathy and intelligence, artificial intelligence, is a way that is inevitable. We're getting there hopefully sooner than we think. There's a lot of challenges, but that is there's no question there that we have to reach that point. So thank you for explaining that. I want to add on to what you mentioned there. One of the articles that you authored at Forbes is the that was interesting. 11 tech investments and innovations that may not be worth your money. That's a general list, right, in all
Mhm.
industries. And I want to be greedy here, and I want to push and ask for the opposite side of that. What is the in your from where you stand in your perspective? What is the lowest hanging fruit basically in healthcare for AI to be the most effective from what you see today?
The thing is, and it's a good question, and the answer is not going to be a groundbreaking concept. And I know there are lots of questions around the moonshots, all of these moonshots that are out there that AI can potentially go after. That's where a lot of the interest goes in. But what
Right.
it comes down to is effectively managing a healthcare practice and then being able to deliver the right type of care at the
Mm,
right moment in time
mm,
at the right cost to both the systems as well as to the patients. And then these are fundamentally basic problems, these are operational problems, but the low hanging fruit problem is there. If the 80% of your cost of operations are coming from 20% of the processes, how do we optimize those processes themselves? And again, very non-sexy type of an answer. We're not talking about solving the word hunger here, but imagine the capacity and then the capital that can be saved, that can actually be then utilized over solving the major problem. One example I'll give you, right? Planning for how many types of job families to have, at what point in time available and ready, optimizing and planning for all of the beds, all of the machines, all of your inventory that has a shelf life, so chemicals, all of your medicines. You cannot have too many of something and you cannot have too few of something. And optimizing for those things that runs the operation is such a crucial thing, because if your total cost of operations is so high that you're not able to reinvest, save and optimize and reinvest that money back into patient care, the patient care side of the innovation will continue to suffer because it cannot self-fund itself. So again, like a non-sexy thing, but the thing is, the other part is that the optimization of the planning processes as a problem space has something that is other verticals, other industries have already been solving for and quite well. And it's the healthcare practice and healthcare industry hasn't fully adopted them yet. So you don't have to reinvent. It's just leapfrog with existing technologies and then reinvest the capital towards these leapfrogging technologies.
right. Before I get to Dr. Tarek, I want to follow up on this with you, Amr.
Mhm.
This is just a general question that it's interesting to ask people this question.
Yeah.
Why is healthcare lagging? And just a very short answer. Why is healthcare lagging in this space?
Why healthcare in the space of AI?
Yes, like you're
Yeah.
saying. adopted in other industries? Why is it
You know,
taken up?
the quickest answer to me is healthcare. I mean, it's human, right?
Right.
Artificial intelligence is human, and is
Right.
its own at the core aspect of it. And if we cannot utilize the best technological elements out there, innovation that are out there,
Right.
for us to have healthy, fulfilling lives, then what's the purpose of that technology?
Right.
So, the question is why not? And then the potential is tremendous, right? So when you think about what is AI good at, AI is good at basically utilizing a complex set of large amount of data, a variety of data and complexity of the data, and synthesizing that in a purposeful way to help us augment with an inference and an answer, right? And then healthcare is a complex problem because the amount of information that has to go into in diagnosing and treating, and then having a long-term outcomes to that requires all of that. So AI is the right fit to help solve some of the healthcare problems because we're sourcing in heterogeneous sets of data and then driving homogeneous and heterogeneous sets of insights and inferences out of it.
Right. That's fascinating. Thank you for answering that. That was a full answer. Thank you. I want to go back to you, Tarek. We touched on the limitations of using AI. I want to talk about the ethics. I'm getting the questions here about how AI can help with children of autism, which is a general question. But I think if we put it into the early diagnostics context, we can have a more maybe useful answer for the audiences.
Mhm.
Someone else is asking, predicting genetic diseases as well, so early detection as well. So I want to thought of what is in this context, what would you say are the ethical threats that we have today, that we're facing today in using AI in healthcare?
So again, that's a very important point. So basically, for us to benefit from AI capabilities, it's really all about having data. If we don't have reliable data that can help us learn the different patterns, learn the different diseases or the signatures of the diseases, then we cannot really accurately make any kind of predictions or classification. So this is one of the biggest challenges, and this is why sometimes maybe using AI in public health or in healthcare sometimes is a bit lagging behind other domains because of the lack of accessing maybe patient data or health data. So in order to solve some of these challenges, we really have to consider better ways in ensuring data privacy so that we are able to sort of share different kinds of data sets and ensure interoperability between these data sets without really uh, violating the privacy concerns of the patients that are sharing these data. So if we're able to anonymize the data, if we're able to use like encryption techniques, so that because all we're interested really is the patterns, the features within the data that will allow us to learn and maybe use transfer learning, for example, to be able to benefit other domains which are lacking this data. We're not really interested in the demographics or any personal items about the data. So if we're able to solve some of these ethical challenges about sharing data, about data privacy, then I think that will really help advance AI in the public health domain much faster.
Thank you for answering that. I have a question. So it seems to be like the data is one of the biggest domains of challenge and most excitement as well in maximizing AI, which makes sense, of course. Data, AI needs data, fluidity. I had a question here for you, Ahmer, about the metaverse. Anna, please tell me how we're doing with time because it's going to help me or prioritize the questions. You, Amr, mentioned in a previous engagement that the metaverse can have a lot of potential harms and threats
Mhm.
in healthcare.
Mhm.
Um, can you give us more light? Like, what are you seeing here?
Yeah, I mean, the metaverse is a fascinating technology, right? That's on the horizon right now, and then some of it is already here. What is fascinating is, as a technologist, I'm excited for the future, and as a member of society, I'm also a little bit scared, and then primarily because metaverse is something that cannot be held down by a certain private enterprise. And we have seen already that the sense of social responsibility and societal responsibility has been lacking primarily from the companies in social media that have, we are seeing anti-science movements and stuff like that, that's floating around. Metaverse actually can exacerbate that problem. But on the other hand, metaverse, if it's led by a sense of mindfulness and purposefulness and empathy and a social and societal responsibility, can potentially be the next space program for the society. That so many potential innovations, everything from the data to algorithms to emerging experiences that can come out of that, that could have potential positive implications for healthcare. So as an example, on one hand, we are likely to face mental health, continuation of mental health issues, because this is not societal, socially and psychologically, humans are not wired to operate in such isolated, so much isolation, right? So it's going to further polarize and further create that sense of isolation, which, in my opinion, can create some mental health problem. But on the other hand, if done the right way and in certain small doses, it can be used, for example, in providing and augmenting better training for doctors and nurses, not just for procedures, but also for patient interactions, interacting with patients with lived experiences and non-lived experiences in underrepresented communities, to make sure that the nurses can lead with empathy. You can run those scenarios in a metaverse type of environment with avatars and practice those. Johns Hopkins University just earlier in the summer have already successfully conducted surgeries with spinal reconstruction surgeries using metaverse-based technologies. So we are already seeing augmentation of that slowly coming in online. So in specific, and on the other side, we can also see potential on the mental health side. It can
Mm.
help solve the crisis of loneliness and depression that aging populations are facing because of the social isolation. And then what if you could go on a walk in a nice garden with a friend that you went to high school with, that you no longer can see because of the mobility challenge? So there are ways to kind of use it in a positive way, but we have to design it with purposefulness for that intention. And without that, if it's just primarily a mechanism to keep driving engagement based metrics, it's going to have problems. So the regulations have to be in place. Yeah.
There's a lot to
I do
follow up
want to
on
address on a
that.
couple of the questions that are coming up on the panels. But yeah.
Yes, yes, yes. Thank you for addressing that. Yeah, definitely. There's a lot to follow up on that, and I will come back to that.
Yes.
I want to move on to the feared black box. They call it the black box, right? Dr. Taro. It's basically just to everyone who doesn't understand. So the black box is the fear of having the AI come up with results like diagnoses or decisions without us being able to explain why and how these decisions were made. It's just done by the AI. It's difficult for humans to keep track and understand where the decisions came from. And we already have live examples, not specifically in healthcare, maybe sometimes with health insurance, but with other and other things in life where there's decisions and we don't know why it's happening. So a lot of people are fearing that. Dr. Tarek, how what are the solutions that you see again from where you stand with regards to this problem? Is it as big as a fear as people perceive, or what do you see there?
So again, a very, very important point, and we get this feedback a lot. So a lot of the fears or challenges that we hear when we talk with medical professionals or healthcare practitioners is that AI or deep learning models, these models are very complex. They are black box, and we can't really understand the decisions or outcomes they are producing. But at the same time, in the AI domain, or if you talk with the technical experts and the researchers working in the domain, sometimes they can challenge that concept as well, because we can go deep inside of the models. We can understand or interpret sometimes how they are working, because AI models are based on really advanced mathematical optimizations. So there are a lot of different ways we can understand how these models are making their predictions. We can analyze sometimes what went wrong, and we don't necessarily have to sort of fully understand all the deep technical details in order to be using some applications. And just to give maybe a very simple analogy, each and every one of us can very easily maybe get into a car and drive the car and learn how to drive. But we don't necessarily have to be expert mechanical engineers or understand the internal combustion engine to be able to drive successfully. Of course, there's a very big difference when you're talking about public health. But some of the different work that has been done to overcome these challenges is that, for example, when we're talking about disease detection using image or radiology, for example. So when we're talking about, for example, pneumonia detection from chest X-rays. So there are different techniques which allow us to identify the different localization maps or the different regions within the X-ray, for example, that led the AI algorithm to propose the particular diagnosis. So using visualization techniques, whether in computer vision or in deep learning techniques, there is a lot of work that is happening to help us identify the different features or capabilities, or maybe the different genes when we're talking about genomics and disease detection, that actually led the AI algorithm to make this particular prediction. So it is a challenge, it is work in progress, and I think we still need to work a lot with healthcare professionals to overcome these challenges. And I think one of the powerful concepts about working in AI is that experts have to work together. So we need experts from computer science, from the technology domain, but more importantly, we need to work hand in hand with health professionals, healthcare practitioners, and this is really where the power of AI can come in. And imagine that we're trying to provide sort of equity in providing access to healthcare professionals. So any one of us don't necessarily have equal opportunity to access a medical doctor or physician with experience. But if this physician is able to sort of get help from an AI model in analyzing maybe thousands of other medical images or radiology images or genomic signatures, and that helps the medical professional make a decision ultimately. That would really be one of the great benefits of AI, and by giving or helping using technologies to interpret why the results from the AI model, this will sort of help overcome this challenge of the black box.
Thank you. There's a lot to follow up on there. I just want to quick note to the audiences: if you have any questions, please submit them down because we're wrapping up soon. Dr. Tarek, you mentioned so you're basically optimistic, which is good news about the feared black box. I would love to get Ahmer your insight on this question, as well as Dr. Tarek mentioned training, right? So a lot of us ask, what are the jobs of the future? And that's one of them, is reading the black box, reading the intelligence of these decisions in healthcare. And you have a fantastic insights on organizational solutions with regards to AI. So in this context of training or making the healthcare professionals qualified to address the black box problem, I would love to hear, first of all, what you think of the black box problem, Amber. And I would love to hear how, if you look at like training the current healthcare medical students or healthcare professionals of the future, or what are the solutions that you from
Yeah,
an
no, thank you.
organization?
Thanks for that question, because what you are especially specifically getting into is the change management aspect of it.
Mhm.
And a lot of the technology solutions fail to deliver and drive value because of the change management element, or the human element has not been taken care of. So in this case, AI is here today, AI is here for tomorrow, and we have to ensure that our staff, from nurses to doctors, are trained well in understanding what AI can and cannot do, where AI augments, where they can challenge. And then the question about explainability is that everything doesn't isn't required to be explainable to everyone. It's the question is, why is it required to be explainable and into what purpose? So designing it for that. I do agree that training at different levels of understanding the basic concepts of the AI to help build the trust is crucial. It's important in driving adoption. The other side of the thing, like as some of the question, I'll kind of jump into that within the trainings aspect of it, right? So one of the questions is about autism, the role of AI in autism. In this case, we're already seeing some research that's coming up. where they are scientists are utilizing brain patterns and brain signals and neural patterns to see if they can utilize AI for a faster diagnosis of any kind of a neurodivergence tendencies. And then the question then in this case is that the doctors who are going to use this AI, what do they need to know about AI to trust that recommendation or potential diagnosis on a potential for autism? And in that case, what element of that trust, the next level, do the parents of that child have to be? And what information and knowledge will be important for them to trust that, right? So there's a level of information for medical practitioners and a level of information for the end patients to be able to trust in that.
Thank
Similarly,
you. Amr,
complex,
I have to cut
oh
you
yeah,
off. Time's up. So
exactly. Okay.
thank you for engaging with us in this panel,
Mhm.
Amr and Dr. Tarek. There's never enough time to talk about public health and AI. I just